I'm Daria Shaw, and today I will be interviewing my aunt, Akira Smothers. So, Aunt Akira, what is it that you do?
I am a registered dental hygienist.
Okay. And what does a dental hygienist do in the dental office?
So, a dental hygienist is responsible for evaluating the oral health of patients, the periodontal health, and also doing dental cleanings.
How long have you been a dental hygienist?
I have been a dental hygienist for 12 years. I graduated from Old Dominion University with a bachelor's degree.
And where is it that you work?
So, right now, I'm currently working as a temp hygienist. And what that does is that when any office, if their hygienist is out, they'll give me a call. If I can fill in for them, then I will. The good thing about being a temp is that it gives me the flexibility that I need. So if I want to work, I can, and if I need to be off, I can.
And is there any specific uniform that you have to wear?
Comfort is better. So we typically love to wear scrubs. Some offices will even staff members will get together and pick certain colors so that they can coordinate.
So, can you describe a normal day in the dental office?
So a typical day in the dental office is we will try to get there about 15 minutes prior, 15 to 20 minutes prior. That gives us time to kind of get our room set up. We set up our trays, and that's where we set out everything that we're going to need for the patient. And then we'll have time to review our charts, and we also get together and have a morning huddle. And that's where we talk about patients. If the doctor needs to relate anything to the hygienist or vice versa, that's the opportunity that we have to do those things.
So, how long did it take for you to get your training to become a dental hygienist?
For me, it took me 4 years. Different states, depending, it could be anywhere from 2 to 4 years. Some states offer an associate's program, and that's still in effect. Eventually, though, that's going to be kind of faded out, and then it'll only be a bachelor's degree that you'll be able to get. And so for me, it took me 4 years with a bachelor's degree.
Were there any specific tests that you had to take to obtain your dental hygienist license or registration?
Right. So once you have successfully completed school, you have to take 3 examinations. One is a national board, and that's where you have a series of questions that you sit for. Then you have a clinical part, and that's where you bring in a live patient and you do a cleaning on that patient and you're evaluated. And then the third one is the laws exam. Each state has different laws, and so they want to make sure that you're abreast of their specific state laws.
Okay, so you're saying that for you to practice in a certain state, you have to be licensed in that specific state?
Right. So for me, for example, I am licensed in several states. So I'll give you an example. Like I'm licensed in Virginia, but they don't have reciprocity in Florida, and I'm also licensed there. So some states will have reciprocity, and that's where they'll say if you turn over certain documentation, then they'll let your license stand. But a lot of states don't have that.
Okay, so are you currently satisfied with the salary that you're making?
Yeah, I am. I would always, making more would be better, but I'm satisfied.
So, what are the qualities necessary to be a dental hygienist?
I think one of the most important qualities is communication. And the reason I say that is because a lot of times patients are very fearful of a dental treatment. And so you need to be able to put that patient at ease, communicate what they're going to be having done, the importance of having it done, and educating them. And so you really need to be able to communicate well.
And do you have any negative feelings towards your profession, or do you like what you're doing, or do you love it? How do you feel about it?
So I actually love dental hygiene. I love being able to make a difference in someone's life. Now it's more than ever, people are becoming aware that dental health is associated with their overall health. And so that's making people more conscious of being on top of their dental hygiene. The one thing I would say that I would like to change or would like to better is having the care that's needed for the youth. A lot of children miss school every year because of dental pain. And a lot of times it's because their families just cannot afford to have the work done. They don't have the dental insurance that they need. And so if that avenue could open up to be able to serve the youth better, I would want that.
And how do you think your health career impacts the community and the health profession overall?
Well, in the community, we do a lot of health fairs. We go out to the schools and we do screenings for them. And so that's a way that we bring dental knowledge to the community.
And well, so like you guys go out in the community and you help like the community and schools and stuff. So how do you think this impacts the education that the kids and other adults receive?
I think that it really impacts them, because if you were to go, let's say, speak with an older person, their idea of going to the dentist was when they had pain and they would get a tooth taken out. Okay, and then over time, after tooth, they would maybe have a partial or denture. Well, now the youth today, they go to the dentist for preventative care, and that's to prevent decay or to handle decay when it's very small. And so the likelihood of those people being able to keep their teeth when they're older is much higher. And I think that has to do with the education that they have now been able to receive.
Okay, well, I think this concludes our interview. I want to thank you for coming and telling us about your health career.
You're welcome, Will.
Thanks. Bye.